Good morning everyone. My name is Dolsy Sharma. I'm working as a clinical instructor in RPIIT College. Today we'll discuss about the topic urine incontinence, nursing diagnosis, risk for fluid volume deficit related to altered urinary output, interventions, weigh patient daily, take accurate input and output measurements, place all parenteral therapy on an infusion pump, monitor amount and characteristics of urine, auscultate heart and lung sounds every shift. Nursing diagnosis, impaired skin integrity related to constantly wetting of skin. Interventions demonstrate good skin hygiene, example, wash thoroughly and pat dry carefully. Instruct family to maintain clean dry clothes, preferably cotton fabric. Educate patient about proper skin care. Nursing diagnosis, activity intolerance related to involuntary passage of urine. Interventions, assess the time and amount of maturation. Instruct patient to use the toilet at specific time. Teach bladder control exercise, example Kegel exercise. Encourage patient to participate in activities of daily living. Provide appreciation and positive reinforcement to the patient. Nursing diagnosis, deficient knowledge related to unfamiliarity with the nature and treatment of urinary incontinence. Interventions, assess the client knowledge level, encourage patient to ask queries and doubt related to disease condition, listen patiently to all questions, provide appropriate information regarding the treatment regimen. Nursing diagnosis, fear and anxiety related to disease condition. Interventions, patient listen to all the concerns of the patient, encourage to ask questions and queries for the patient and relatives, explain the disease condition and treatment regimen to the patient, make sure all doubts are clear and patients feel calm and confident. Patients teaching, nurse need to educate the patients and relatives about limit control water intake, checking drinking habits, eat fruits, vegetables and whole grains daily to prevent constipation. Stop smoking because the nicotine irritates the bladder. Urinate every 3 to 6 hours to retain bladder. Person should perform Kegel exercise. Care of exercise. Skin should be kept clean to prevent infection. Maintain body weight. Observe people. Have risk. Advice to take healthy diet and regular exercise. Fecal incontinence. Fecal incontinence is defined as the inability to defer the elimination of liquid or solid stool until there is a social acceptable time and place to do so. Minor incontinence, it is the inadvertent escape of lattice and partial soiling of the undergarments with a liquid stool. Major incontinence, it is the involuntary excretion of feces. Prevention of fecal incontinence in elderly after age of 65 years, 15% in community dwelling women, 45% in nursing home residents. Many patients are embarrassed and do not report the physician. Anatomy. The rectum, it is hollow muscular tube 12 to 15 centimeter long, composed of continuous layer of longitudinal smooth muscle that interferent with the underlying circular smooth muscle. The anal canal, the length of the anal canal is about 44 centimeter, 3 to 5 centimeter, with 2/3 of the piece, this being the pesitinate line and 1/3 below it. The rectum contains 3 distinctive semi-lunar mucosal folds which helps to maintain its capacitance. The rectum can accommodate 300 ml without any significant increase in the intraluminal pressure. The anal mucosal folds, together with expensive anal vascular cushions, provide a seal. Risk factor: age, depression, dementia, neurological disease, immobility, constipation, female sex, vaginal parity, Pashi, and a history of operational vaginal delivery, women with pelvic floor dysfunction, urinary incontinence, pelvic organ prolapse. Structural abnormality, change fecal volume and consistency, altered mental control, neurological disease. Clinical assessment, stool diary and clinical features. The history should initially focus on whether fecal incontinence is truly present and its severity. True incontinence must be differentiated from frequency and urgency without loss of bowel contents, which can occur in setting of inflammatory disease, irritable bowel syndrome, and pelvic irradiation. Pathophysiology, physical incontinence results from conditions that interrupt or disrupt the structure or function of the anorectal unit. Common cause includes sphincter weakness, neuropathies, both peripheral and generalized, disorder, diarrhea, fecal impaction with overflow, and behavior disorder. Diet and lifestyle, control fecal impaction, bowel training, anal sphincter, pelvic floor exercise, biofeedback, anal continence plug. Nursing diagnosis. Altered bowel elimination related to the lack of voluntary sphincter control as evidenced by patient's inability. Assess the bowel pattern, identify the cause behind altered bowel elimination, try to understand the modification of behavior of the patient, Administer medications as prescribed by the physician. Nursing diagnosis, imbalanced nutritional status less than body requirement related to dietary restriction. Interventions, assess the nutritional status of the patient, check his dietary habits. Calorie and high fiber diet has to be provided. Risk for impaired skin integrity related to involuntary passage of feces. Assess the hygienic conditions of the patient's skin. Maintain the hygiene and cleanliness around patient. Frequent assignment can detect signs and symptoms of possible infection. Patients teaching limit control food intake, checking eating habits, eat fruits, vegetables, and whole grains to prevent constipation, do squatting to strengthen the muscle, prevent UTI, maintain body weight, care of skin.